Hello there, Dr. Carlo Oller with PatientEducation.TV. Here we're answering another fan comment or question. This one comes from Michele, and it says, "Hey, Dr. Carlo, my son had a boxer's fracture. I recently posted a video about boxer's fracture, which is a fracture of the metacarpophalangeal right here. And he initially went to the ER, then followed up with an orthopedic surgeon, and he was told he would need surgery to correct the bone alignment, but he didn't. Because he wanted to take more time off from work and thought he could take care of it. Now this is when he was 20 years old at the time, and now this is years later. So now his hand looks bad, still has pain from time to time. So the question is, can he or should he have corrective surgery now to fix his hand? Thanks for all the information you share with all of us, and God bless." Well, the question is, certainly if they do surgery, they're going to realign that bone. The chances that he's going to have a good healing, being in his 30s maybe, and if he doesn't have diabetes or other medical problems, the chance of successful surgery is pretty good. But it is surgery, so there is expense. Number two, there's always risk of non-healing or malunions or trouble with that. So the question is, how much does it bother him? Just because it looks weird or deformed, no big deal, right? As long as it functions, he's not a guitar player or a piano player, nothing that requires a lot of dexterity. Usually people with a chronic fractured boxers will have a problem with bending that finger inwards. Instead of going like this, it kind of will tilt inside like that. And that can limit range of motion, grabbing things, and of course can create some arthritis pain of the joint. But if the pain is from time to time, I mean, we all get those. If he works a lot with his hands, he would get pain anyway. So is the pain incapacitating enough that he would need surgery? That's a personal decision. That's up to you. I'll be honest with you, I don't like elective surgery because what I end up seeing is all the complications. People who the surgery did not go well, either the pain's worse, they got an infection, they have worsening pains and symptoms, the hardware goes bad or it gets pushed out. So my experience as an emergency physician is the bad cases, the case that it doesn't go well and they don't heal well. So it's up to your son whether or not he gets it fixed. Obviously, it's a matter of how much it really affects his daily living. How much pain does he get? Is the kind of pain takes emotion and goes away? Or is the kind of pain that he can't use his hand for a day? That's what's going to make the most difference, and that's the decision to make. But it is relatively a minor surgery because it could be done under a brachial plexus block. He doesn't have to be sedated, put down for it. Again, they just have to refracture the bone, align it, put some kind of pin, screws. I mean, everything's very accessible right here. So it shouldn't be a hard or difficult surgery. The problem is going to be recovery. I mean, I just had a minor procedure with the removal of tiny little cysts of my crack, and week and a half out, I've been hurting and itching, and it was sore, and I think it got infected. I took 2 days of antibiotics, and tomorrow I have my checkup, and it still bothered me. So was it worth it? I mean, well, maybe a year from now I'll say, yeah, it was worth it because now I don't have any problem. But right now I'm second guessing whether or not it was the right thing to do. Just leave it alone and wait till it gets bad, you know? So anyway, I hope I answered your question. If I didn't, I'm sorry, but I'd love to hear your comments or any follow-up questions. I'd love to answer those. We'll see you. Bye-bye. If you enjoyed this video, please consider subscribing and hitting that bell notification so you don't miss any new episodes.